This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's podcast, I'm going to discuss new news in the vaccine world, as well as natural immunity and what we're seeing in the community. Big news released last week with the expansion of the emergency use authorization for the Moderna and the Pfizer vaccine going down to 6 months of age. They're at different doses than adults, but cleared to go down to 6 months of age. And the degree of the heart conditions related to that are thought to be small. Those are usually adolescents at an older age and male, and of moderate to significant benefit in children that have obesity and asthma. Community level and transmission level, which are two different things. We talked about that before. They both remain medium and high, respectively. And there may be a little inside baseball reason why our testing is high, because testing does influence the transmission level. And we have an amazing public health department here. In full disclosure, I sit on their board. But they have continued to provide free testing to residents. So the access to testing is actually a little bit higher in this county than others. And whether or not that's influencing the number of tests that are being positive is yet to be seen. Just a little inside baseball. Wastewater report remains stable. It hasn't dropped to zero. It has slightly plateaued, but at a very low level. We'll continue to follow that. And communication with the water department today will probably have information and data going for at least another 6 months into the new year of 2023, and hopefully longer, because I think that has been of some value in predicting peaks, particularly the Delta. Was very helpful. Critically ill patients in the hospital, vaccinated, unvaccinated, about 50-50, and the number is quite low. We have no critically ill patients in the hospital as of this morning, and maybe 5 COVID patients, which 3 of them are probably admitted for COVID-19 infection, and the rest are just incidental findings why they're here. Vaccine information expansion down to 6 months of greater than 6 months of age is good news for families that want to protect their children. But I have more good news for families that are concerned about their children. And that is the natural immunity study out of Israel followed 300,000 children through 2020 into December 2021. It was an 18-month study, and it found that children have a good immune response, particularly 5 to 11-year-olds, and have an 89% effectiveness of natural immunity, and it appears to be sustained for at least 18 months. Now, in this country, all those children were unvaccinated, and it was Delta. In this country, Moderna's data that came out last week is in unvaccinated Delta children, and that had a 77% effective rate. So it shows that natural immunity is a little bit stronger than the vaccine, and we know that the vaccine and natural immunity combination provides even more benefit based on studies done here in the United States. CDC's own data shows that 75% of kids in the United States have had COVID, and only 2 out of 100,000 require hospitalization, and they typically have obesity, and asthma is the most common, with a death rate that is 0.001%, quite low. But that is an apple-to-apple comparison of our data and the Moderna data with the Israeli data, because these are all unvaccinated Delta patients. Now, the question here is, will Omicron have the same benefit? That is yet to be seen. If I had to guess, I'd say yes, but we'll see that in the coming months, that we may have a vaccine or booster specific for Omicron. Thank you for listening to the COVID-19 update. For the latest COVID-19 information, including vaccine information and more, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.